In tonight's Health Alert, a new report from the World Health Organization finds there are at least 650 mysterious and rare cases of hepatitis in children. It's been found in 33 countries, but about one-third of those confirmed cases are here in the U.S. Now, the agency says 38 children worldwide have needed a transplant due to the unexplained liver inflammation, and 9 children have died. Well, parents have lots of questions about this, and joining us to answer some of those are ABC News Chief Medical Correspondent Dr. Jen Ashing. Jen, great to have you back on the show.
Oh, thanks, David. Good to be with you.
So let's go. First question I have is, what do we know about this, and do doctors know what's causing this outbreak?
So more questions than answers at this point, David, but what we know, first of all, hepatitis is the umbrella term for liver inflammation. There are a variety of hepatitis viruses that we know about. They're letter named A through E. This particular series of cases that's getting headlines right now are none of those. So it's being called hepatitis of unknown origin. The leading theory in cause is that it may be linked to a very common respiratory and gastrointestinal virus known as adenovirus. About 35% of the U.S. pediatric hepatitis cases have also tested positive for adenovirus, but it's still not enough evidence to show a direct cause and effect. I think what parents need to know right now, this is uncommon. The World Health Organization and the CDC continue to track it. Unfortunately, they do expect the number to go up because in medicine, when you look for something, there's a greater chance of finding it.
You know, you just said it. It's uncommon. We're talking only about 650 cases around the world. That, right, to me seems like a relatively low number. So really, how concerned should parents be when they hear this news?
I think the reassuring sign, David, is that there are signs and symptoms of hepatitis that generally are obvious to parents, even of young children. So the classic one is jaundice or yellowing of the skin or the whites of the eyes. And then GI symptoms like fever, abdominal pain, nausea, vomiting. If any of those symptoms or signs are present in your child, you of course want to be in touch with their pediatrician. As you mentioned right now, 1% fatality approximately, and so anytime we see a bump in something that's uncommon, it's going to get the attention of infectious disease and public health experts around the world.
It's just so great to have you always on the show. And isn't it great not to be talking about COVID for one appearance, David, at least?
Absolutely. This time it's another virus.
Right. It's always something, but we got you, and that's all that matters. Dr. Jen, thanks again for helping us out.
Thanks, you bet.